Are you planning to start Medicare and not sure where to start? In this video, we're going to talk about what you need to do and when you need to do it when you're planning to start Medicare for the first time. Whether you're turning 65 or coming off a group or employer plan, we'll talk about exactly when to sign up and what to know. Hey guys, Alex Wender here, founder of Blue Wave Insurance Services, where we help folks across the country with their Medicare and retirement needs. So let's cover a few basics. Medicare is made up of parts A and B. Medicare A is your hospital coverage and Part B is your doctor coverage. You need both A and B to purchase a Medicare supplement or a Medicare Advantage plan. Medicare Part A is free for most people if you have worked for 10 years and have 40 working credits. There'll be no premium for Part A, however, Part B does have premium attached to it, and that premium in 2024 is $174.70 per month for most people. It's important to know that this can go up based on your income. The government will look back 2 years, and if your income is above certain levels, they will charge you more for Part B. I will link below to the IRMA income brackets for 2024. So other than the cost, it's important to know when to sign up. So let's start with a common situation. Someone who is turning 65 and planning on going onto Medicare A and B for the first time. So in this situation, you will have a 7-month window to start Medicare. This is called your initial enrollment period, or IEP. This starts 3 months before you turn 65, lasts the month of your birthday, and then lasts for an additional 3 months. So it's a total period of 7 months. For example, if you were turning 65 in April, your initial enrollment would start in January and continue for 3 months. It would include the month of your birthday, which is April, then last for 3 more months, so it would end in July. This is a total 7-month period, which is your initial enrollment period, where you can enroll onto Medicare A and B for the first time. If you enroll before your birthday, coverage is always going to start the first of the month that you turn 65. So in this scenario, it would start April 1st. Also, someone who is turning 65 and going on to Medicare Part B will have the option to either purchase a Medicare supplement plan or a Medicare Advantage plan. It's important to also know the windows to enroll into either type of plan. If you're going with a Medicare supplement plan, you have a 6-month open enrollment that starts the first of the month that you turn 65 and lasts for 6 months. During this period, you can purchase any Medicare supplement plan offered by any insurance company in your state without any health questions or any health underwriting required. Also, if you're going with original Medicare and a supplement, you will need a standalone Part D prescription plan to go with it. Enrollment for the Part D plan is the same as your initial enrollment for Medicare A and B, which remember is 3 months before you turn 65, the month of, and 3 more months, so a total of 7 months to get a Medicare Part D plan without a penalty when you're turning 65 and starting Medicare for the first time. So we talked about the window for enrollment when you're turning 65. Now let's talk about the window for enrollment if you're coming off an employer plan and you're over the age of 65. If you're coming off an employer plan, typically you already have Medicare Part A and you just need to get Medicare Part B because you delayed it. So what we recommend is getting the process started to sign up for Part B 1 to 2 months before your employer coverage ends. That way there's no gaps in coverage between your employer coverage and Medicare. You can sign up for Medicare Part B online. You will need to provide proof that you had credible coverage through employment, and you can do that right online. Technically, you have 8 months to get Medicare Part B when coming off credible coverage, but it's best to get Part B started right away. So again, there's no gaps between your employer coverage and Medicare. Some important enrollment timelines when you're starting Part B for the first time and over the age of 65. The open enrollment for a Medicare supplement plan is still the same 6-month window when you're new to Part B as if you were turning 65. So if you're coming off an employer plan and you're signing up for Part B for the first time, you have 6 months to get a Medigap plan without any health underwriting. However, you only have 63 days to get a Medicare Part D prescription plan without a penalty. Again, that's 63 days from the last date of your employer coverage. So this window is very different from somebody turning 65. If you decide to go with a Medicare Advantage plan, you'll have 63 days from the date your employer coverage ends to get a Medicare Advantage plan coming off that employer coverage without a penalty. So again, sign-up window for a prescription plan or a Medicare Advantage plan is much shorter when you're coming off an employer plan than when you're turning 65. So keep that in mind. So as far as planning your upcoming enrollment into Medicare when you're turning 65, we recommend starting to plan the initial enrollment period 3 months before you turn 65. Sign up for Medicare A and B, decide what type of plan you want, whether it's a supplement or an Advantage plan. And then if you're coming off an employer plan, we recommend starting the process 1 to 2 months before you know the date your coverage is going to end. You would let Social Security know that you want your Medicare Part B to start right when your coverage ends with your employer. If you're interested in shopping plan options, whether it be a Medicare supplement plan or a Medicare Advantage plan, we would love to help. We charge nothing for our services, and you can give us a call at the number below, or you can use the link in the description to book an appointment with us. We'd be happy to shop plan options for you and answer any questions that you have. If you enjoyed this video, make sure you click like and subscribe below to stay updated on all things Medicare and the latest changes. We look forward to assisting you. Stay healthy and take care.